am Melissa Fuller with Shape of the City, and today we're going to be talking about the Nebraska Physicians Cancer Screening Project, and we are with Drs. Bob Rauner and Dan DeFreece. Welcome. Tell me, how did this project get started?
It started here in Lincoln after a meeting where we had a presentation by Dr. Ali Khan, who's the Dean of College of Public Health. One of his health priorities for Nebraska was that Nebraska has higher colon cancer rates than the rest of the country, but at the same time worse screening rates. So if we want to prevent it, we need to fix that problem. And so we started assembling kind of a group of Lincoln clinics to start working on this, and it kind of grew beyond Lincoln and went outside of Lincoln, so we renamed it the Nebraska Physicians Cancer Screening Initiative, not just Lincoln. One of the early clinics outside of Lincoln to jump on was Dan DeFreece's clinic in Nebraska City.
And talk about what is the mission of this project?
Yeah, well, it comes off of, there's a national effort called 80% by 2018, where they want to try to get 80% of people screened for colon cancer by 2018. And so we started a couple of years ago with that goal, and every clinic kind of set their project to try to get there. And quite a few of them actually made it by 2017, so we'll see if a few more get there this year, which obviously 2018. So.
Well, talk about how does this work? What are you guys doing? Talk a little more about the specifics.
Well, most of the time in clinics where we spend our time just seeing patients, patient after patient after patient. So this is a little bit different project for clinics to look at patients as a population and to reach out to them to try to make sure they get the test done they need. And of course, we focused on the breast cancer and the colon cancer screening part of that. So I was actually setting up a process in our clinic to identify people that either needed to have their screening done or hadn't had that done, and reach out to them to help them get that process done.
Perfect. And how is a project like this funded?
Well, we started out with basically grant funding. So we asked a few people to kind of support the effort and pay for the educational portion of it. And we had grant dollars from CHI St. Elizabeth's funded some of it, Nebraska Medical Association, Blue Cross Blue Shield of Nebraska, and Copic Medical Foundation funded it.
And what have you guys learned so far? Where are you guys at?
Well, it's been a very interesting process for our clinics because they had to actually sit down and develop a project and work through that project and assign people to do that. So what we've learned is we can do it, and we can make a big difference for our patients in Lincoln and the surrounding areas. So this project then is going to lead to other projects to help improve the health of Nebraska, basically.
Yeah, I think also the clinics took a look at their entire population, where a lot of medicine, it's always one-on-one. You come in today, here's what do you need today, and that's kind of been the main focus historically. This you take, like say Dan may have 2,000 patients, let's look at all 2,000 at the same time, which you can pull out electronic medical records nowadays and say, okay, out of those 2,000, who should get screened, who hasn't get screened, how are we going to reach them, and we can use email reminders, text messages, phone calls, put in a process in the clinic, so when his nurse checks the patient in and says, oh, you need this, so you have extra people mentioning that to them. It could be front desk or a care coordinator. And so different roles in the clinic changed to make it work better.
So for our viewers out there, how would you sell the urgency of a program like this?
Well, the urgency is that obviously there's a need to have these screening tests done. They've been shown to help improve health and longevity, and of course the complications due to these diseases. So the urgency is out there to do it. So, and I think just having the clinics be aware that this is necessary and to help them through that process is very important. And in fact, they'll probably see something different. Instead of coming in and say, do I need this? They'll have the question asked, would you like to do this, because we recognize that you haven't had it done. That's a little bit different focus in medicine, especially in primary care.
Yeah, it's kind of a prevention focus too, is that colon cancer is probably one of the most easily detectable early cancers there are. And there's already a lot of studies showing that the earlier catch it, you'll save people's lives and even save money actually. Because if you catch it in a small polyp stage, it's much easier to treat. It doesn't require the extensive surgery, radiation, chemotherapy, things like that. So if you can catch this early and there's such a good screening test for it, you could really save lives and money.
You received a national award recently. Can you tell us a little about that?
Yeah, well, there's what's called the National Colorectal Cancer Roundtable. It's part of the American Cancer Society. They've been trying to get places around the country to start working on this and recognize them if they've done a good job. And so there's a couple groups throughout the country that they recognize, and Lincoln was one of those this year.
What can other communities learn from a program like this?
Well, I think one is if you work together. I mean, we have actually competing health systems working together on the project. One Health Nebraska, which is an independent group, the Physician Network, which is part of Catholic Health Initiatives, Bryan Health. We have multiple groups all working on the same project at the same time, and when they do it together, it's better for the community.
I think the key is the way we do it is the same. Patients are the same, the goals are the same, even though we have independent, different groups and stuff we belong to. The goal is to have a healthier Lincoln. and the healthier surrounding areas. And when we all work together along those lines, we can do great things.
So where's the future headed? What are you guys up to in the future?
Well, we're going to kind of use the same method for other stuff, so not just cancer. So we've got really good rates for breast and colon cancer screening now, and we hope to maintain those. And so we're moving on to 2 other projects. One is around HPV vaccination, which is actually a vaccine to prevent cancer, and that's focused in adolescents. So if we can get them that vaccine, that'll prevent cancers later in life. The second one we're focusing on is diabetes, because it's such a highly prevalent disease. There's a lot of people with diabetes, a lot of healthcare. Like an example I'd use is a local employer, all of their healthcare costs for all of their employees, about 15 to 20% of it's tied back to diabetes. And so if we can do something about diabetes, we can eliminate a lot of unnecessary suffering and costs there too. So, and then Dan's clinic's going to start working on that this year.
And a lot of the same processes are already in place. So we can see using the same types of methods in our clinic, the same people, the same ideas, and just rolling those from breast cancer and colon cancer right into diabetes, HPV, whatever process we do as we go along. And we think it'll be quite successful. And the clinics are excited about it. They're very pleased to receive the award and see the fruits of their effort.
Thank you guys. Thank you for all the work you're doing, and good luck in the future.
Thank
Thanks.
you.